call upon Dr. V.K. Swami to give a presidential address. Dr. V.K. Swami is the chief patron of the organizing committee of ISTATHON, India's first accredited forensic odontologist and former director of JJT University. Dr. V.K. Swami is a very well-renowned name in the dentist circle in influencing them towards their goal attainment and shining among the other professions. He has founded professional regulatory councils, that is, CAFO, Council of Accredited Forensic Odontology, Coctracy, Council of Cosmetology, Trichology, Regenerative and Aesthetic Sciences of India, and Oral Maxillofacial Implantologist, Laserology, Oncology Council of India. He is also the co-founder of Dentress Career. I would now like to hand over the mic to Dr. V.K. Swami. Please give a big round of applause.
A very good morning to all. First of all, I apologize for late beginning. You know very well everything is already decided. Whatever the time, whatever the action, everything is already decided. So we have to follow the timeline. So in that stance, I will be little bit apologetic for starting this program little bit late, but we will do some latest things, don't worry. So I welcome you all. Before inviting, I will tell one thing. Informally, I have told to somebody else that we are going to do bigger things. What we have committed is slowly unfolding. We have our Indian Parliament in front of us. Yes, Dr. Tol Thirumavalavan sir is representing Indian Parliament. You know, worldwide there are three types of, rulings. One is parliamentary democracy, then judicial review, then constitutional supremacy. In India, we have all the three. If you ask me the precedents, even though we have written constitution, constitutional supremacy will precede over the parliamentary democracy. Sometimes the same parliament going to create the constitution, amend the constitution under Article 368. So it's a win-win situation for us. So we have our member of parliament. So he is very, very, down to earth. You might have seen by this time. And he is a keen observer and listener. And you know why he is like so? Because of his field. He is basically he was a chemistry graduate. Then he is student of law. He had completed his law. Then he has this masters in criminology. Criminology has forensic sciences as one of its subjects. So he sees the world. What is the problem? He sees the problem. Then he acts accordingly. So he suddenly asked me a question. Yesterday we were coming through the car, escorting him after receiving him in the airport. He was asking, many a times he is asking the same question. Why did you call me? So, I have the answers, but I didn't tell him fully. I will tell you right now. I belong to the community called forensics. Forensics, what is forensics? Forum means court. Forensic means what? Nowadays, I will tell you, since Dr. Prasantji ignited the Puranic Itigas and all, I will start with the same thing. There are 4 yugs. Can anybody tell me what are the yugs? Satyug? Don't change because I don't know the Sanskrit version. Satyug? Slowly. Satyug. In Satyug, one by one you tell me. Please help me. Thanks for the helping. So in Satyug, good and bad people were in different planets. Am I right? Good and bad people in different planets. Then Dwapara Yug. No, S-T. Treta Yug. Yes. So I have remembered in STD. Okay. So T means Treta Yug. In that, good and bad people in the same country in different places. And what is the next yug? Dwapar Yug. I think good and bad people in the same family. Can I correlate with Mahabharata? Isn't it? And what is this next yug? You know, in Kali Yuga, good and bad people in the same person. So how will you identify? How will you identify? Everything you need forensic lens. Other than that, you will be simply be, misbehaved, or you will be misled. Okay. So he is the right person to judge. We are going to place certain things. You will be judging rightly because you have that approach. Approach is very important. See, same thing seen by two different person. You know the story of the elephant. Same elephant seen by different people, and they interpreted differently. Okay. So you will be seeing the right interpretation. So that is the one reason to call him being a forensic expert to this event. Am I right? Am I right? Then? Okay. Secondly, he represents downtrodden, poor, women, suppressed, all the communities in the parliament. You can go and Google. He represents all the suppressed, those who doesn't have voice for themselves. He is representing. So, should we represent ourselves through him? Yes or no? No, very less means the bill cannot be passed here. Okay. So, he is the right person. Yes, that means you are still downtrodden. You are still suppressed. So, since he is there, let us show the power. Yes or no? Yes, sir. Okay. So, now what to represent? We are not asking for give us a government job. Monthly you deposit some amount in our bank account. We lead a peaceful life. No. For that matter, many people going and sitting in Jantar Mantar. Give us job. We are not doing. We have the skill. Are not we? We have the skill. Talent. Allow us to utilize our right. Allow us to utilize your right. So second reason why we have invited him. What will be the third reason? What will be the third reason? Tell me, please. The third reason is, he is the most proactive MP in the parliament. So that is why we are, see, everything is give and take. So this is our policy. Now, let me explain about our councils. When I was passing out my BDS exam, okay, I was totally confused, collapsed, what to do, what not to do. Many people advised many things, but I started my practice. While starting my practice, I come to know there is some kind of politics going on. Because dentists, not only dentists, any profession, if you see about only your pocket, your family, your children, end of the day, what you will do? At the time of crisis, nobody will help you. So I start uniting the people. I traveled almost all states. So I come to know every dentist facing the same problem. That means responsibility without power. When British came to India, they made all of us responsibility without power. So this is the fourth reason we invited him. Why? Because he used to tell achieving political power, in other words, politicalization is the key. Without politicalization, you cannot get your rights to be implemented. So with these reasons, we have invited him, and we are going to make some serious issues. And he had assured us there will be 2 private member bills in the parliament. One for the right, the other one for the protection. What is the right? We have the right to practice, which is guaranteed in Indian Constitution. Right to profess. It is in Article 19. Right to profess. If you have the talent, if you have the skill, you should be given the right to practice. If you are devoid of right to practice, you can approach the court. Can anybody ignite me? And under which section we can approach the court if your fundamental right is infringed? Article 32, you can go to directly Supreme Court, and Article 226, you can go to High Court. In this aspect, High Court has more power in writ jurisdiction. So, what I mean to say is, you have the talent, you have studied 5 years in BDS and more than of that in MDS. If not also, you have the talent, you have the skill to operate in your area. What is your area? Maxillofacial region. almost 2/3 of the head and neck region. Right now you tell me, is there anybody called stopping your right to practice in that area? Please open up. If you open up, it will be heard in the parliament. Just open up. Is anybody saying you, no, you should not do it? Yes, come out. What is the problem? Whenever you are doing any treatment in this area, lower 2/3 area, many people coming and saying us, you should not have done that. You should not have the power to do that. Okay? Like many people, we are not naming the fraternity. They are also our fraternity. So in that case, we have to fight for our right. So I request you to volunteer to give the inputs for drafting the bill. It will be introduced in the parliament. In front of our leader, I am committing to that. So just raise your hands. We will form that committee so that we can represent what are all the things to be incorporated in the bill. Why silent? You could not believe. Dr. Manzoor, give him a big hand. He is in the committee. Please stand up. Now you tell me who are all in your committee. Yes, sir. Please, Dr. Williams. Yes, he started his work now. Yeah, please join him. Yes, sir. Dr. Williams. Any other person? There are 5 people. Who is that? Dr. Kapil Sharma. Yes. Yes, sir. Please stand up. Others will see. He is going to help us in drafting that bill so that we will have the full right. Whatever we are read. See, you have studied what are the subjects. Anatomy, physiology, biochemistry, pathology, microbiology, pharmacology, medicine, surgery, then what not. Anything you left out, which other studying you are not studying, you have to have full right to practice in your area. I am not saying being a dentist, go and do open heart surgery. Many people are doing. I think we are missing Dr. Murugadas. He is saying, I open cranium. Sometimes, see, emergency, you can do anything. Suppose a patient coming to you, having toothache, is collapsing in the dental chair. Will you save or not? Or you will say, I am a dentist. He will go in the back door. You have to save the person. See, simply saying, dentists are not treating the teeth. They are treating the human beings. Having the teeth and not having the teeth also. Denture. So we are treating the human beings. So, where is your 5 persons? 1, 2, yes, your name please? Yes, 1, 2, 3, 4, and I myself. Okay? Can I nominate myself? Okay. Please take care of the names. So this is the first bill for the right. Okay? Now come to the protection. What is the protection? See, suppose a patient is having some medical illness. He is in the OT, operation theatre. Okay? So, for example, he had grade 3 of carcinoma, oral cancer. Okay? So, in the oral cancer, they are operating. Who are all operating? Who are all the persons in the table? Pardon? Yes, Dr. Ranipriya, please tell us. Yes. Anesthetist, plastic surgeons, maxillofacial surgeon. I doubt. This that should be not. What is the practice? You tell me. Are they any oral maxillofacial surgeons here? So you are being called in every operation in the oral cancer. Yes, sir. Please. No, you deal oncology. Whether they deal you or not. That is the problem. We congratulate you. You are going and joining, but it should be in law. That is why we need. Now see the problem. Sir, you are an influential person. Yes, sir. So that is the reason. That is the secret of your energy. You run a hospital and you influence the persons. But I am talking about the common parlance, common practice. So it is not there. So we have to protect the patient or not. I am not saying protecting us. Protect the patient. The onco surgeon need not be knowing which forceps to be used on which tooth. Am I right or no? So who is the right person? Dentist should be incorporated in the team. Any surgery, medico-legally, I used to teach in the colleges. Medico-legally, there is a concept called vicarious liability and captain of the ship policy. And one more policy is there. Let the superior answer. If anything goes wrong, so the superior person should be answering. That is one concept. The other concept is captain of the ship. So in the maxillofacial region, who is the captain of the ship? Again, you fall the prey of dividing and ruling. Call dentists or dental surgeons or dental doctors. Maxillofacial surgeons did not contribute the required amount of validity to us. Am I right or wrong? I will tell you a simple example. In AIIMS Rishikesh, they have opened one MCH course in that they have given channel for these oral surgeons. End of the day, the court said oral surgeons cannot be there because they come through dental route. So through MBBS MS route only we consider them as surgeon. By the time oral surgeon did not fight there, they lost the case, and here coming and fighting and coming and saying only oral surgeons should be there. No, we will not permit. All the dentists should be part of the table when you operate in the maxillofacial region. Any dentist can be part. Yes or no? Show the majority. So this is the second bill we are going to request our member of parliament with due obligations that please take this forward. And the second bill is protecting the rights of the, fill up the blanks, patients. Patients has the, see in our constitution we have article 21. What is that article 21? Right to life. It has been modified now, right to decent life, not simple animal existence of life. So every person, every patient has the right to life, to have proper, to receive proper treatment. So they should be treated by a team of doctors. They should have, of course, should have the dentist in the panel. Okay. Here I have some selfishness. I will add one more line. Every post-mortem report should be carrying the assent of forensic odontologist, or by that matter, keep the dentist also. After the death I am saying. Every autopsy report should carry the report of the dentist or not. How many of you supporting? Because first of all, you leave all the cases, you finish the video evidence, everything. End of the day, you say there is no bite mark, there is no evidence, there is no dental evidence. Incorporate in it. You want to identify all the cause of death or not? Cause of death, mode of death, you want to probe or not? Many cases pending, I don't want to name, because of want of evidence, particularly dental evidence. You know the truth. MBBS people coming only 15 days for dental posting. In a medical college setup, when I was there in GDC Chennai, Government Medical College Chennai, we never saw that those 15 days when MBBS people came and studied dental related things. But in the postmortem, they do all the fillings, they do all the findings, they diagnose everything. Am I talking about right or not? So shall we incorporate this also? So two bills. So who are all the committee members for second bill? Yes, sir, please. Dr. Hiramat, please. Yes, you tell, you rest of the people, please come forward, 4 people. We will have meeting, separate meeting, don't worry. If 12 o'clock also happening, we will have meeting and submit the report before our MP leaves for parliament again. Yes, in the coming session itself. Sir, that is not, I cannot announce. This is our request, so I am placing in front of you. Yes, Dr. Akbar. Yes. Don't shy. You are there. Yes, sir. Dr. Saravana Kumar. Yes, please. 2 more. Dr. Vignesh and Dr. Mansoor. Yes, give him a big hand. Dr. Mansoor. So, in these rights, we will definitely talk about the trichology, hair transplant, wherever you have the talent, you showcase. And for your information, I am saying these 3 days, just a initiation. It's an initiation ceremony. In Sanskrit, can I say Upanayan ceremony? No. Starting. Okay. Let us don't miss. Pranam. So these 3 days, just initiation for your learning. Just 3 days. You cannot learn anything. But many people learning, hours together. Yesterday, how was the classes yesterday, by the way? Just good. So, paisa vasool ho gaya? Huh? So I am announcing some people coming here will get next level. What is the next level? You have to do master's level courses in these emerging disciplines. So I request the learned people to collaborate with the universities till the time government is making those courses under our Indian universities. Till the time, I think Professor Gunachandran type of people in nature will definitely work on it, and the Denver city will help in getting these MSc courses. Till the time, you can follow up our trainings, and tomorrow, I am telling you, whoever qualifying this first round, they will be inducted as a fellow, and you will be given training. For that separately, you need not pay anything. Just cheer up. You need not pay anything. That's it. So, whoever willing to get trained by the experts, and I want to give the secret of our energy. See, for example, Dr. Akshada Shetty. Okay, she is coming to teach us. I am telling you, she is not collecting single penny. Could you believe? Please give her an applause. She is coming here to teach. I think she will be in a better position to explain. So, but despite all these things, some mentors here, okay, they may charge. Don't worry, we will pay them. But you don't pay. You don't pay a single penny to the mentor. Then the whole agenda will be collapsed. Okay, it is not a commercial place for making business. Okay, you pay whatever the required amount, because we cannot fund from ourselves. Okay, got the point? So any mentors asking some big amount which you could not pay, kindly report to us. Okay, in a good note I am saying, I am not responsible. If you are paying to somebody to learn the things, see, stop individual worship. Worship your discipline. Somebody interested to become an oral oncologist, who is that? I think Dr. Arshia Merchant. So, what we are planning, we will give you online lectures, offline training, and we collaborate with cancer hospitals. You go there 15 days, you take OT observatory. You wear your gown, everything, you stand in front of the team and learn the things. Is it fair enough? You start doing this. Then slowly the condition will change. Because there are a lot of people dying out of oral cancer. And our hands are tied. We don't know the regime. We don't know the chemotherapy. What are the drugs to be given? Okay. So definitely the day will come. We are working tirelessly. And I need only one thing from you. What is that one thing? Can I give my bank account? I need people. More and more people should be joining together. This is a movement. You know, many people saying, this is a conference, where is the sponsor, where is the companies, where is the exhibition? You can call it as a conference, but not in true sense. This is I can say you, this is your worship place. We are transforming you. We are making you to realize your power and the quality of lectures, you know. Because, see, many things given free of cost, it will be quality. Can you say any example? I think half of the people still enjoying this Baga beach. That is example. See, beach is not, the air condition given in the beach is free of cost. So don't say free means it's many people spreading the rumor. Like you pay big amount, then only you will learn fully. Then privately, Dr. Akshada Shetty will charge you 6 lakh rupees for 1 hour. You go and pay her. How many of you ready? So come here, bring others. Many people secretly coming. I was inquiring with 2 people, one person saying, I am coming to Goa. I was asking, what about your friend? He is saying, no, I didn't inform him. And you also don't inform him. And some people bring people together, like our Dr. Alvin. He's a faculty in a college. He brought 10 of his students. And I was telling him, are you bringing all these students with the due permission of your dean, principal? He said, sir, he only sending. Give him a big hand. And one more committee is pending. I will finish my introduction. We are going to form an awards committee. It's my request, please consider for a dental college award East College. Because he had brought 10 people from a single dental college to upgrade themselves. Please consider. Okay. So whoever the committee, okay, the committee will be released by Dr. Pasha, organizing chairperson, because I cannot take decision on your behalf. So in this committee, you please consider, and we are going to award tomorrow. And as of now, the Goa CM is confirmed. He will be coming. He will be the chief guest for the awards night. I think one Bollywood singer also coming, I think. Those things you can confirm with Nisha ma'am only, because I have poor knowledge in the Bollywood industry. So this is it. So how many of you again going back to the lecture mode? Okay, so a small correction, you have to wait because our leader is going to give his speech. I am also eager to listen. After that, we will resume. Thank you very much. Just now I got the information. There is a provisional journal is getting released. We have to travel long way. There are some approvals from many things are pending in the journals, but we have released it. Let us see. Okay, so that also to be released today. Thank you. I was thinking there will be a pack I have to open and release. These people already released informally. So it's not my mistake.
Thank you, Dr. V.K. Swami, sir, for your inspiring words.